Hi, everyone, and welcome to this lecture. My name is Valerie Worthington, and Celine Kuman-Vega and I put together this presentation for you on communication and expression. And the purpose of this is to introduce you to the vastness of the field of communication, particularly as it relates to healthcare from a mind-body medicine perspective. And our hope with this presentation is that you'll be introduced to some new skills, some new research, and hopefully some new concepts that help you to expand your conceptual understanding of the topic of communication. To start, I want to invite you to take in this image, which first of all represents the vastness and the complexity of communication. And second of all, shows the beauty of communication. When we think of communication, we may immediately think of the written or spoken word, but language is by no means the only container for communication. Communication is everywhere, and in fact, sometimes it occurs whether we mean it to or not. When it comes to verbal communication, that type of communication includes words. It also includes our voice, the tone that we use, the volume at which we speak. And on the other hand, nonverbal communication may include things like gestures, posturing, our facial expressions, the energy we bring to an interaction, and any other behaviors and actions that we bring to any sort of conversation or any sort of interaction where communication is taking place. It's important for us to think about how complex communication is and how many parts. We have the communicator, and that is the person who is sending information, also known as the sender. There's the message itself, what is being communicated or what is being attempted to be communicated. There's the person or other being that is on the receiving end of the message. And we also need to take into consideration the way the recipient is receiving the information, which is going to be mediated by the recipient's perception of the message as well as the sender. And there are also many more subtle aspects, including things like the intention behind the message. Implicit in the concept of communication is the intent to connect with another. So when you think about that, who and what do you communicate with on a regular basis? Notice that another could be, but is not limited to, yourself. So perhaps there are parts of you that are communicating with other parts, other people, animals, nature, a higher power, and maybe even other communicatees that may not even be listed here. Now I want to invite you to pause for a moment and consider a relationship where you would like to improve the communication between you. Perhaps it's with a spouse, a partner, a parent, a child, an employee or an employer, or even within yourself. What happens when you experience a roadblock in your communication with that person or that entity? What does it feel like for you? Notice what happens in your body. And how do you react? Do you shut down or withdraw? Do you insert yourself or increase your emotional state? What message or cognition do you tell yourself? Do you go towards blaming or judging yourself or the other? What's important to think about when it comes to communication from a mind-body perspective is the impact and the importance of good intentions. We've probably all heard that phrase about the road to hell, but in this kind of communication, good intentions matter. I mentioned earlier about the importance of intending to use empathy in our interactions in a healthcare context from a mind-body medicine perspective, and perhaps many of you already do this. Empathy is so all-consuming. It encompasses so many parts of who we are and of our humanity that it's important for us to pay close attention to how we come across to those that we would communicate with. And this quote that's on the slide here encapsulates this notion. The patient will never care how much you know until they know how much you care. So the idea of empathizing with your client or your patient is the first step toward being able to help them heal themselves. If empathy is so important from a mind-body medicine perspective, it would be useful to know what it is. The American Psychological Association defines empathy as understanding a person from their frame of reference rather than from one's own, or vicariously experiencing that person's feelings, perceptions, and thoughts. Empathy does not of itself entail motivation to be of assistance. In psychotherapy, therapist empathy for the client can be a path to comprehension of the client's cognitions, affects, motivations, or behaviors. And I invite you to keep this definition in mind as we continue our conversation. It may not come as a surprise to you that this focus on empathy stems from the fact that Saybrook is a university that's based in humanistic psychology. And as such, it makes sense for us to review when the field of communication became more humanistic. Communication as a field, as a social science, was not really studied until the 20th century. And then in the 1940s, Carl Rogers came along. He was an American psychologist, best known for pioneering client-centered therapy. And he was also a founder of the humanistic movement in psychology. He introduced the concepts of reflection and empathic listening. Empathic listening takes Rogers' core concept of empathy and looks at how it's conveyed to the client through methods of reflection or reflection of feelings. So these notions of reflection and reflection of feelings are considered empathic communication methods. After Rogers, Thomas Gordon came along in the 1960s. Gordon is best known for parent effectiveness training and teacher effectiveness training, which were modes of communication designed to help parents and teachers communicate with children. But eventually, those tactics and techniques were expanded for use in communication generally. Gordon proposed several listening modes that he referred to as communication facilitators, which turn out to be useful but insufficient tools for helping us truly communicate. And I'll explain why. The first one is passive listening or silence. Silence and attention do encourage people to talk, but such silences do not necessarily convey empathy or warmth. And if someone is talking about something delicate or sensitive to them, then just the mere silence may not convey a sense that the speaker is feeling safe. The second communication facilitator is acknowledging responses, both verbally and non-verbally. And these convey to the person that we're really listening. So a nonverbal might be a head nod, and a verbal cue might be uh-huh or oh. These are useful in demonstrating that we're actually listening, but they don't necessarily demonstrate that we actually understand or are simpatico with the person who's speaking. The third kind of communication facilitator is a door opener or a facilitator to talk. These are mostly open-ended questions that encourage the person to talk, but are still considered passive. It isn't until we get to active listening that we come to a real interaction. And that's where we as the listener try to convey our acceptance and the accuracy of understanding of what the speaker is trying to communicate to us. Active listening is sort of a decoding process where we try as a listener to understand what is going inside the person, what the meaning is of the message. but it's always an inference or a guess. And we don't know whether we're right or wrong about our inference or our guess until we receive validation from the person we're interacting with. And Gordon proposes focusing on the feelings about the situation and not the situation itself, so as to keep the onus of personal responsibility on the person who's speaking. The interaction that's guided by active listening helps the person who's speaking, whether it's a child or a student or a peer or a partner, to move away from the surface of the problem to the underlying problem or concern. Now I'm going to state the obvious. The researchers on the previous slides are white men. The people who put together this presentation and the person who's delivering it right now are white women. And unfortunately, there is a lengthy history of the white establishment making systematic attempts to separate members of marginalized cultures from their language and customs, from their modes of communication. And just one example of this is the residential schools in the United States and Canada that took Native American and Native Canadian children from their families to quote unquote civilize them into white Anglo customs. So while Rogers and Gordon's work and findings are still important today, so too is doing what we can to expand our systemic understanding of what constitutes effective communication. And this involves cultural humility and cultural competence, a commitment on each of our parts to learning more about and improving our competence in cultures of which we are not a part. And this in turn requires a commitment on each of our parts to identifying, preventing, and eradicating discrimination in communication to the best of our abilities. So what this means is that failing to communicate effectively is not only a nuisance, it can actually materially hinder justice, equity, diversity, and integration. So how can we be more inclusive? Some examples are refraining from tone policing, which is defined as adjudicating the voice of another. We can recognize the validity of patois, slang, syntax, code switching, and other practices that depart from what is systemically propagated as quote unquote standard English. We can honor cultures we do not belong to by exercising our cultural humility. And we can commit to improving our cultural competence through learning more about cultures of which we are not a part. Another thing we can do is to think about the communication roadblocks on the next slides and how we can eradicate those. I want to invite you for a moment to think of communication, effective communication, as a flowing stream. So maybe you're in a boat flowing along the stream of effective communication, and all of a sudden you hit a big rock or a branch. Gordon would call that rock or that branch a communication roadblock, which is in contrast to the communication facilitators that he also conceptualized. These roadblocks express both an implicit and sometimes overt message that communicates a desire for the listener to think, feel, or behave differently than they would authentically. And sometimes along with that desire is a pressure for that to happen, for the listener to change what they think, what they feel, or how they would behave to satisfy the speaker. Gordon categorized these communication roadblocks into different types of messages. And here are some examples of these different types. First, we have solution messages, directing, ordering, or commanding. For example, stop crying, try harder, or you have to do this. Then there's threatening, warning, and punishing. If you do, you'll be fired, or you'd better do this if you don't want bad consequences. Then there are preaching, moralizing. For example, nice girls don't do that, or you really should do this. Persuading, arguing, lecturing. The fact is, or when you're older, you'll realize that. Advising, recommending. What you should do is, or why don't you, or haven't you ever considered? So these are some examples of communication roadblocks. And I invite you to think about that implicit message in them that the listener is being asked in some way to change their fundamental response. Another type of communication roadblock is the put down message. There are three types here, or three categories here. Criticizing, name calling, characterizing, and blaming is one of them. So for example, you messed up our plan. You never do this. You always do that. You're a liar. You're a thief. You're a typical lawyer. Another type of put down message is sarcasm or teasing. So what I'm hearing you say is that the world is all wrong and you're always all right. The third type is diagnosing, psychoanalyzing, or mind reading. Oh, you're just saying that because you're overtired. This is just a phase you're going through. You're just anti-man. The third type of communication roadblock is the cop-out message. So for example, withdrawing or diverting. I won't discuss it any further, or not now, or even the dreaded silent treatment. Another type is cross-examining, interrogating, or fact-finding. So for example, well, you must have done something to bring it about. Or, are you sure you're telling the truth? And finally, communication roadblocks can take the form of pseudo-supportive messages. You might see the word supportive and wonder how that can be a communication roadblock. But see how these land for you. When it comes to praising and approving, an example is, that's a good job, or you drew a pretty house. Reassuring, consoling, excusing, or sympathizing is another example. It'll feel better in the morning. I'm sure he doesn't dislike you as much as you think. You look fine at this weight. And then finally, the Me Too messages. Oh, I have that trouble too. I can totally identify with that, and I know exactly how you feel. I want to invite us now to take a moment to reflect a bit on our communication so far about communication. Take a little time to process the conversation. What thoughts and feelings are arising for you as you consider the conversation? And I invite you to just notice those thoughts and feelings. Don't feel compelled to judge them. And what questions and viewpoints might you bring to our larger discussion? I will remain silent for 1 minute. And then if you would like to have more time than that to consider some of these thoughts and feelings that are arising for you, I invite you to pause the recording for as long as you wish. We've talked a lot so far about how communication doesn't work. Well, what are some strategies for communication that do work? One is iMessages. You may have noticed that most of the communication roadblocks we talked about earlier were statements or questions that started with you. They were you messages. And Gordon believes that iMessages, which he created during play therapy with children, often help us address communication roadblocks. In those cases of communication roadblocking, he believes that an I message would be more effective because you messages are likely to be heard as blame or analysis. Also, these messages of blame or analysis communicate nothing about the inner state of the person who's uttering them. iMessages, on the other hand, can be called responsibility messages because they help the speaker convey how they are feeling or what's going on that's affecting them. So to this extent, iMessages create a more effective confrontation or conversation because they don't prompt the communicator to engage in negative evaluations of others. And therefore, they promote a willingness on their own part to change in a positive way. There are three components of iMessages, particularly in the context of conflict or disagreement, according to Gordon. These include a brief, non-blaming description of the behavior that you find it unacceptable, your feelings, and the tangible and concrete effect of the behavior on you. So iMessages express feelings, beliefs, or values of the speaker, how the speaker sees things and would like things to be. And examples of iMessages include, when I see or hear X, the practical effects on me are Y. This makes me feel, or this makes me want. iMessages then segue us into a model of communication called nonviolent communication. This was developed by Marshall Rosenberg, who is a student of Carl Rogers's. And the purpose of nonviolent communication was to foster compassion, collaboration, and caring in our relationships, both within ourselves and with others. The nonviolent communication approach emphasizes compassion as the motivation for action rather than fear, or guilt, or shame, blame, coercion, threat, or justification for punishment, or any of the other negative reasons that we communicate with one another. And nonviolent communication is intended to create human connections as well as systemic governmental and corporate structures that support compassionate giving and receiving. So nonviolent communication is something that happens both internally to the individual and across people, across structures, social structures. It's important, even given that is the case, that we recognize that nonviolent communication is applied to the speaker. In other words, we apply nonviolent communication to ourselves, and we can use it whether the person or persons that we're speaking with are familiar with nonviolent communication or not. We don't use nonviolent communication to judge or tone police others. Over the years, nonviolent communication has matured into a program of training that's offered in more than 65 countries. And it's been applied in a variety of settings like schools, hospitals, and prisons and restorative justice systems. So the notion of nonviolent communication has relevance for the helping professions that many of you are likely to find yourselves in, and maybe you already do. And along the same lines, maybe some of you already have significant experience with nonviolent communication, and maybe some of you have none at all. If you don't have any experience with it, then it's something you might enjoy exploring. And all of you are encouraged to bring your thoughts, experiences, and questions about this and everything else to the large group discussion. What is the origin story of nonviolent communication? Well, Rosenberg became curious about what he observed, where certain people find joy in lifting others up through compassion, but certain others find joy in breaking people down. And he wondered where that came from and also where the language of oppression was born. So if you're keeping people down, you are oppressing them. And how did that happen? And where did the language come from to classify and describe that? I'm guessing we all unfortunately know that words can lead to hurt and pain. And Rosenberg traced the origins of this use of words to harm to 8,000 years ago, to the beginning of when we started classifying people. So for example, people who are superior and inferior, people who are normal or abnormal, people who are royals or people who are peasants. So that class structure became embedded, as did behavioral patterns that were created that included punishment, reward, and guilt. So if you were not behaving the way you were supposed to based upon your category, then there were punishments. And from here, he deduced that there was a language that was necessary to support those behaviors, and that some people were socialized, programmed to communicate in those ways that lift people up, and some were programmed or socialized to communicate in those ways that tear people down. And while studying these factors that affect individuals' ability to maintain compassion, Rosenberg also noticed the role of language. Our training sometimes leads us to speaking in moralistic judgments, evaluations, and labels, and these disconnect us from compassion. And you might remember, or you might be thinking of some of those communication roadblocks that we just talked about. Did you see moralistic judgments, evaluations, and labels in some of those communication roadblocks? Well, the notion of nonviolent communication, the idea there is to bring communication back to the heart and back to compassion. At its core, nonviolent communication consists of several basic principles, including honesty, clarity, respect, empathy, there's that word again, connecting to our deeper needs, noticing, and compassion. In more detail here, first of all, we reframe how we express ourselves and how we hear others. We bring consciousness to our responses based on our awareness of what we perceive, what we feel, and what we want. We express ourselves with honesty and clarity, which means we need to know honestly and clearly what we need and want. We give respect and empathic attention to others. We learn to hear our own deeper needs as well as those of others. We take careful observation. We notice behaviors, and we notice conditions that affect us. It's important to repeat that nonviolent communication does not require that the person with whom we are trying to communicate know nonviolent communication or even be motivated to relate compassionately. This is not about controlling others' behavior and choices. It's about exploring our own in the service of better communication if we decide to use the principles of nonviolent communication. The process of using nonviolent communication involves observations, feelings, needs, and requests. The person using nonviolent communication observes what others are saying or doing that is either enriching or not enriching their life. They articulate observations without evaluation, moralistic judgment, interpretation, or diagnosis. People who use nonviolent communication state how we feel when we observe an action. We then state what needs of ours are connected to those feelings. And then we make clear, specific requests for actions to meet those needs. So again, it's important to draw attention to the fact that the use of nonviolent communication requires a lot of self-knowledge and a lot of willingness to introspect. The two parts to nonviolent communication are empathy and honesty. When it comes to empathy, which we've already discussed, we receive from the heart. We connect with the other. We sense their feelings and needs. We remain present and aware of our own needs. And when it comes to honesty, we give from the heart. We truly understand ourselves and our own needs. And we remain in tune with what is alive in us. This slide shows a model of how to use the nonviolent communication process. I want to invite you to pause the recording so that you can take a closer look. In short, in the left column, there's explanation of how you express yourself using nonviolent communication. And the right column is about validation and reflecting empathically whether someone is using nonviolent communication with you or not. And it can be particularly helpful when blame is present, though it can be used when blame is not present as well. Now I'd like to invite another reflective moment. We spent some time going into some detail about nonviolent communication. And here I want to invite you to take a moment to think about where and how you may have observed nonviolent communication at work in your own life. I invite you to consider how it feels to you and how you might actively bring the principles of nonviolent communication to your own life. And finally, would you be willing to do so? And consider your reasons, whether your answer is yes or no. As with the last reflective moment, I will be silent for a minute. And if you need more time or would like to take more time to reflect, then I invite you to turn off the recording until you're ready. Another communication tool you might find useful working with clients or patients is motivational interviewing. Originally, motivational interviewing was for work with people who have alcohol use disorder, and it was intended to help individuals resolve ambivalence that may have hindered their positive behavior change. The idea being that they wanted to change their behavior so that they were not reliant on alcohol anymore, but that's easier said than done. So the elements of motivational interviewing, or some of the characteristics, are: yes, expressing empathy. There it is again. The idea also is to refrain from directly confronting resistance. Instead, it's important in motivational interviewing to use resistance to change, to considering a different viewpoint, whatever it is, as an opportunity for exploration rather than to challenge it. So in that way, resistance becomes data. It becomes an indication that there's something to explore, but there doesn't need to be a judgment attached to that exploration. One of the concepts or the tools that can be used to help facilitate behavior change is the development of discrepancy. And this discrepancy is usually between the current and the desired behavior. So where do I want to be in life? And what behaviors am I engaging in that will help me get to where I want to be in life? And what behaviors am I engaging in that will keep me from getting to where I want to be in life? As I mentioned just earlier, or implied just earlier, we avoid argumentation when we use motivational interviewing. And we encourage self-efficacy. We promote the belief that individuals have the ability to make decisions for themselves. Well, since we talk so much about empathy when it comes to communication from a mind-body medicine perspective, what does the research say about empathy? Quite a lot. And here we have just a few examples of some of the ways that empathy is implicated in and studied from the perspective of healthcare. First of all, when it comes to healthcare communication, Pasalacqua and Segrin, as well as Gatkas et al., found that stress and burnout negatively affect practitioners' capacity for empathy. And that's got implications for our own self-care as practitioners. Brencio and Moyers and Miller found that high empathy counselors appear to have higher success rates regardless of theoretical orientation. So if you have access to your own empathy as a practitioner, not that it doesn't matter what your theoretical orientation is, but you're more likely to have success with your clients in terms of communicating with them, regardless of what that orientation is, if you have empathy. And with respect to the psychological and physical effects of empathy, Manchik et al. Found that adolescent children of empathetic parents are better able to regulate their emotions and they experience less systemic inflammation than adolescent children of non or less empathetic parents. On the other hand, the more empathetic parents themselves experience greater self-esteem and life purpose, but they also experienced higher systemic inflammation. So the implication here is twofold. First of all, the notion of empathy as having an impact or being related to our physical health, and also the notion or the implication that sometimes empathy can take something from us. So this brings us back to the notion of self-care as healthcare practitioners. Up until now, we've been talking about modes of communication that are verbal in nature. They may have some nonverbal elements to them, but they also have verbal elements to them, and those verbal elements are the focal point. And so now, for the remainder of this presentation, we'll talk a little bit more about nonverbal communication, specifically the role of emotions, attunement, and the expressive arts in our communication capacity. So I implied earlier that nonverbal communication is complex, and it is very complex. As part of a way to kind of get our arms around the complexity of nonverbal communication, we'll take some time now to explore emotions, facial expressions, and perceptions. Specifically, I'm going to share two perspectives from two researchers that are in complete opposition with one another. And this is important to remember from a researcher perspective as you embark on your own research journeys, whatever those look like, because you may find yourself in conversations where things are not clear or further research needs to be done, which is always the case, but where maybe there are two camps or multiple camps who have differing opinions and beliefs about a topic of interest to you. With respect to emotions, we have Paul Ekman and Lisa Feldman Barrett. Paul Ekman is known for his ability to detect lies, and in fact, the main character in the television series Lie to Me is based on him. In Ekman's research, he explores the relationship between emotions and facial expressions, and he has systematized this relationship in a classification system that he calls FACS, which is the Facial Action Coding System. Ekman believes that emotions are universal. And what that means is that he believes that people everywhere recognize the same facial expressions as indicative of the same emotions. On the other hand, though, we have Lisa Feldman Barrett, who has emerged in the recent years as a new voice in the field of emotion. And she's got a unique perspective on how to think about it, which she encapsulated in an article that she wrote in 2006 called Are Emotions Natural Kinds? And in it, she basically threw down the gauntlet and positioned herself strongly against Ekman's position that emotions are biologically based and universal. And instead, she argued that emotions are culturally agreed upon. She says that emotions are more complex than Ekman's experiments would suggest. And in Ekman's experiments, he has participants engage in forced choice static image selection. So is this emotion this or is it that? And Barrett argued that candid, spontaneous emotions are much more difficult to correctly identify, and that people do not always get them right, and that people do not always demonstrate the same facial expressions when they experience a given emotion. So another element of Ekman's studies is that the emotions that he displayed for participants to choose from were posed. And what Barrett is arguing is that emotions in the wild, so to speak, are much more complex. They may be fleeting. They may be combined with other emotions. So posed emotions are going to elicit a different response than emotions that we see occurring naturally all around us. And part of the issue here is what constitutes proven. So Ekman claims that the evidence for the notion that emotions are universal is very robust, proven from a statistical perspective. So in his work, he has found that people across cultures were correctly able to categorize emotion expressions on average 58% of the time. And this is greater than chance to a statistically significant level. But the question is that enough? Is that statistical significance at 58% enough? And Barrett believes that the answer is no, because if we're talking about universality of emotions, then we would want to see much greater than simply above chance accuracy. Barrett also argues that Ekman's stance does not allow for the complexity of human emotions, the subtlety, the range of them. And again, as I mentioned, what they look like sort of in the wild. She believes that emotions are totally made up. It's not that they're not meaningful, it's just that words like joy and rage and shame describe a whole host of complex processes that occur in the brain and the body that aren't necessarily related. We've just decided that some of these things should be lumped together and we've named them. And so the notion of emotions is something that exists because we as a culture, we as a society have agreed upon them. So in short, one perspective argues that emotions can literally be read on our faces and are universal. And perhaps you've read a novel or short story where this very wording about reading an emotion on someone's face was used. Her sadness showed in her face as if it had been etched there. The other perspective suggests that emotions are much more embodied, contextual, influenced by culture, and difficult to identify. And that perspective argues that emotions have meanings because people agree to define them in certain ways. Now let's take a look at a couple of examples. In this side, you can see an example of a set of images that Ekman might have participants look at. When you look at these images, what do you see? And how would you describe each emotion? And if you need more time, feel free to stop the recording until you're ready to continue. And here we see an example from Barrett. If you look at the woman in picture A, how would you say she's feeling? If you had to guess, you might say that she's in pain. But if you look again at that first picture, when the face is placed into a bodily context, what changes? How might your perspective change? Maybe you might now see this person as ecstatic instead of in pain. The overall point is emotions as nonverbal communication are incredibly complex. There's a lot of research out there to tell us what they mean, and there's still a ways to go before we can understand truly what someone is thinking, feeling, sensing when we observe their emotional state. Another nonverbal mode of communication is attunement. The definition by Erskine is provided for you, and it bears reading aloud, which I will now do. Attunement is a kinesthetic and emotional sensing of others, knowing their rhythm, affect, and experience by metaphorically being in their skin, and going beyond empathy to create a two-person experience of unbroken feeling of connectedness by providing a reciprocal affect and/or resonating response. And since we are in a healing context, in a health and wellness, mind-body medicine context, the definition of therapeutic attunement is also provided. Therapeutic attunement goes beyond empathy to provide a unity of interpersonal contact and the facilitation of psychological healing. And this definition is also from Erskine. Attunement has two parts. The first one is, say it with me, empathy. And the second one is communication of empathy or sensitivity to the other person. Among other things, the notion of attunement is relevant for the socialization of children by their parents. And according to Kohut, children must receive empathic attunement from their caregivers, or else their feelings become fragmented and an identity split begins. And there are implications here for the child's ability to engage in secure attachment. And what this means is that the lack of attunement may negatively affect this ability. In a therapeutic context, practitioners may use empathic attunement to facilitate clients' healing from the age when they didn't receive it as children. Another angle on attunement or facet of attunement is affective attunement. Stern defines affective attunement as the sharing of affective states in an intimate relationship. Affect attunement is related to and sometimes referred to mirroring, empathic responsiveness, or affect synchrony. Affect attunement refers to the experience of being witnessed and tracked, of being intimately understood through an experience of profound interpersonal relatedness. And Siegel shares that this affect attunement has a positive impact on children, and it is parental communication that conveys this to children and enables them to amplify their child's positive emotions and share and soothe negative ones. And now I want to share with you an example of attunement in this video. It's about 5 minutes long. Okay, thank you so much for watching that. And I invite you to jot down some notes or take note of what came up for you as you watched that video. So there was a lot of communication going on in that previous video. And this notion of attunement, which we saw, is a good segue into a discussion of the expressive arts. It turns out there isn't actually a lot of research on attunement, but expressive arts have been seen as a vehicle to enhance therapeutic attunement. As some of you may know, maybe some of you are artistic already, and the expressive arts combine visual arts, movement, drama, music, writing, and other creative processes to foster deep personal growth and personal introspection. And as we've been learning throughout the lecture today, communication never happens in a vacuum, and neither does expression. So expressive arts can be a method for communicating our inner expressions. And in a therapeutic or a client or patient-based setting, they can be used with clients as a method for connecting and listening to their internal world and for drawing that out to help us as practitioners learn more about how we can best support them. As we come to the end of this exploration of just a few of the modes of communication that are relevant to a mind-body perspective, I want to invite you to this reflective moment. So consider for yourself, what did you learn that you did not know before? And what memories or prior knowing came up for you? And what thoughts and feelings are you going to take with you that you may find somewhat surprising? And finally, I also want to invite you to think about what you'd like to explore further in our upcoming large group discussion. What do you have questions about? What do you feel it's important for the group to know about you with respect to communication? And I thank you for listening and for coming along with me, and I look forward to communicating with you on Saturday.